Welcome to Youth Diary. Many of our young girls have one or the other kind of gynecological problems. Because of their busy academic schedule and shyness, they are not getting proper advice or treatment. So today we have Dr.Asha Ananth with us. Doctor, welcome to our show.
Thank you.
Doctor, what do you think? What is the commonest problem among young girls?
Yeah, in the OPDs we usually get patients, young girls who come with their mothers usually, they don't come alone, and they usually complain of irregular periods. I think that's the most common problem faced by young women.
Okay.
Yeah.
I think, Doctor, we do have a few young girls who have got a few serious problems.
Okay.
Now let's go on to that.
Hi ma'am, I have a doubt, and my friend Minu is carrying now, and she is also suffering from hypothyroidism. Will it affect her baby?
Okay, the question is about hypothyroidism.
Yes, yeah.
Yes, hypothyroidism means the thyroid gland is functioning subnormally, a little bit less. That is the hormones from the thyroid, T3 and T4, they are produced in less amount. So what happens is that if a woman is suffering from hypothyroidism, her thyroid hormone level will be low.
Okay.
So for the developing fetus, the fetal thyroid gland will be functioning by only about 12 weeks.
Okay.
So there is a deficiency of thyroid hormone for the baby as well, developing baby as well. So it is very important for the developing fetal brain to have adequate amount of thyroid hormones. So it will definitely affect the baby intellectually, and also it can, the thyroid hormone level, if it is very low, that is, you call it overt hypothyroidism. And if it is overt hypothyroidism, definitely you need to take treatment. And the effects that are caused by overt hypothyroidism are, that is, growth retardation, cataract, and definitely it can lead on to stillbirth. And once the baby is born, the baby can be affected, can have severe intellectual impairment and developmental milestone delay. So once you identify the woman to be a hypothyroid, you have to have treatment at the earliest. But 1% of women usually are affected by hypothyroidism in pregnancy.
Okay, doctor, there is another question here. Do you do a regular thyroid screening during pregnancy?
Usually there is, it is worldwide, it is said that there is no need to do a screening for hypothyroidism in pregnancy, but I think in India we usually have a more incidence of hypothyroidism than in the Western world, and we identify more women with having problems with hypothyroidism, so we usually do it. We do the antenatal check. First trimester itself we do it.
I think even the newborn period also, I think most of the doctors will go for a newborn thyroid screening. I think like that we can rule out the hypothyroidism in newborns also.
Yes, because it is a preventable cause of mental retardation in young.
Okay.
It is very
so like doctor, when you said about the hypothyroidism, when they are diagnosed as a hypothyroidism patient, do they have to take a regular treatment during?
Definitely, because your thyroid hormone levels need to be under control. Because once the baby reaches about 12 weeks, the baby's thyroid gland starts functioning, and it can actually take care of the hormone levels. But during the initial phase, the first 3 months of development, it's very important that adequate thyroid hormone supplementation is given to the baby.
That means we are treating 2 patients at a time.
Yeah, definitely.
So we'll move on to the next question.
Hello ma'am, I am Sharila doing my MCA. I have a doubt about cervical cancer. How common cervical cancer, and is there any vaccine for cervical cancer?
Cervical cancer is actually preventable, because we can identify cervical cancer at a very early stage by diagnostic tests like pap smear now. So the most commonly the cervical cancer has got a bimodal peak, that is it peaks at 30 years, 30 to 40, and then again at 60 years. So it is very common cancer in India. In a developing country like India, we don't have regular cervical screening test for our women, so there is an increased incidence of cervical cancer in India. So, but in the young generation, below 25, I don't think there is a need for cervical screening at all, because the incidence is very, very low. And the most common cause of the cervical cancer is a virus, that is a human papilloma virus, and which can remain in the cervix for a long time and can induce cancerous changes in the tissue. which leads on to the formation of cervical cancer. It's rightly said that newer vaccines have been developed right now with 2 types of vaccines. That is, one is the Cervarix vaccine, which takes care of the HPV type 16 and 18, which is the most common subtype which is causing the cervical cancer. And the other one is a Gardasil vaccine, which takes care of 16, 18 and other 2 subtypes, which also takes care of the anogenital warts, which is also associated with the human papilloma virus.
So this cervical cancer, how does it come? Is it only through the sexual activity?
Yes, mostly because in young age group there is definitely there is increased chance of having changing partners and things like that, especially nowadays. So it has been proven to be an important cause of cervical cancer. HPV.
So when cervical cancer is diagnosed, or before going to the diagnosis, like what are the symptoms of cervical cancer?
Yes, once you are having cervical cancer, most common thing will be a postcoital bleeding or an abnormal vaginal discharge. Postcoital bleeding can be there due to other causes also, but main thing is the postcoital bleeding. And the other one is the abnormal discharge, that is blood stain discharge, offensive vaginal discharge. These are the things that are usually noticed.
That is it like immediately after intercourse, or like otherwise also do you have?
Immediately after intercourse usually you get the postcoital bleeding sometimes. But it's most commonly in the after 30 to 40 only this comes.
Okay, so
in younger generation, I don't think in the younger generation we need to focus on preventing this in future. So we have to vaccinate our young girls actually.
Okay, right. We'll be back after a short break.